Hello everyone, this is Dr. Kazi, and in this video we are going to learn about the anatomy of the endocrine system. So let's have a look at it. We have two major structures of the endocrine system in our head: the pituitary gland and the pineal gland. In the neck we have 5 endocrine structures. 4. Parathyroid gland, which is situated on the back of this thyroid gland. Let's have a look at the pituitary gland first. The pituitary gland is small and oval shaped, and it is connected with the brain by a stalk. This stalk, which is known as the infundibulum or the hypophyseal stalk or pituitary stalk. Now, this anterior pituitary and the posterior pituitary will be protected in the sella turcica of the sphenoid bone. It will pierce the diaphragma sella, and it will be in the hypophyseal portion of the sphenoid bone. Now, the pituitary gland is divided into the anterior pituitary, which is also called as the adenohypophysis, and the posterior pituitary, called as the neurohypophysis. Now, why the separate names are given? It is because of the embryonic derivation of both the tissues is different. One is from the neural tissue outgrowth, and other is from the other structures. Now, the anterior pituitary is divided into 3 parts: the pars anterior, the pars intermedium, and the pars tuberalis. The pars anterior is also known as the pars distalis. Have a look at this diagram. The pars anterior forming the major portion of the anterior pituitary. Between the pars anterior and the pars intermedium, there is a little space or the cleft present, and it is because of the remnant of the embryonic pouch. Now, the pars tuberalis is a projection of the pars anterior into the pituitary stalk. It covers the pituitary stalks anteriorly as well as laterally. So we call that the pars tuberalis. Let's have a look at the relation of the pituitary gland. This is the sagittal section, and this is the coronal section. The sagittal section is something like this, and we're going to see what is in front of this pituitary gland, what is behind it, or posteriorly, superiorly, and inferiorly. So in front of the pituitary gland, we can see that anteriorly we have the sphenoid sinus. Inferiorly, we have the body of the sphenoid bone. Posteriorly, we have the basilar artery as well as the part of the body of the sphenoid bone. Now, the diaphragma sella is covering this pituitary gland from all sides, anteriorly, posteriorly, superiorly, and inferiorly as well. So it can be anywhere. In the coronal section, like the section from this side, we have the cavernous sinuses laterally on both sides. This is all about the anatomy of the anterior and the posterior pituitary. In the next video, we are going to learn about the development of the pituitary gland as well as the thyroid and the parathyroid glands. Stay tuned, and I will see you in the next video.